Hi, I've been getting a lot of different clients and talking to a lot of different people who ask questions about what lab tests should I be asking my doctor to do. And sometimes people are afraid to be, their own advocate because they feel like the physician or whoever they're working with is thinking that they are maybe psychosomatic or dealing with things that are in their head. Well, yeah, maybe it is in their head. It's their brain and it's not working because something down here and in your liver or whatever in the other part of your body is not doing or performing as it should. So as a functional medicine certified nutrition counselor, am I a doctor? No, but I was a nurse and I did work with cardiothoracic surgery. So I've also worked in the psych ward. I've worked in different parts of the hospital, but I dealt with my own issues. And I was placed on a lot of different medications for mental health, muscle aches and pains, all kinds of digestive issues. So I understand what some of these medicines can do that are over the counter and that are something that you're prescribed, So you have to really look and think about why these are being prescribed to you. What is it you're dealing with? So getting to the root causes. And some of the things that we test for are the Ig markers or immunoglobulins. And the reason I feel so strongly about checking all of them is because sometimes there's multiple factors here. And people are immune burdened from either some toxicity they're living with, that they're exposed to, or maybe it's what they're eating. And, it's really difficult in really, if you're living in a small area, if you're in a dorm, or if you're going to school, or you're in you've got an apartment that is not well kept, or the building is not kept up, and you're dealing with like rodents and insects and things like that. And those poopies and things that they leave behind can be dangerous. So, thinking about all these different things, but one of the reasons that I like to check, and this to me, I think sometimes physicians and sometimes even diagnosticians don't look at the factors that might be exposing you to certain things. And then they're saying, well, we don't need to test for that because, that's not anything that we're seeing in your lab work. Well, your body is always working for you to protect you. So when it's protecting you, you've got to think about all the barriers in your body that are working to protect you. You've got the nasal area, you've got the mouth, you've got the ears, you've got the entire skin, all over your skin, and then you've got the backside. All these areas are working, and even for women, the whole area down in the pubic area and where all your internal organs are, those pathways, they have to have specific bacteria and performers. It has to be that right, not just pH balance, but bacterial balance to help fight off anything that shouldn't be there. There's people that are doing all kinds of things in those areas, the sexual connotations of, interaction, but that can lead to problems. And also, I want to mention, if you're using a lot of types of enemas and things like that, that can lead to actually a breakdown of those barriers, those necessary environments that need to be there to fight off infection and that can create imbalances either in the pelvis or, in the lower gut. So I am reading from Lab and Diagnostic Tests from Nursing Implications. And this is sort of like gluing things together from what I've learned in Functional Medicine Coaching Academy, which is excellent material. and then also bringing it, because they bring so many experts in, and then bringing that to the plate with the functional nutrition counseling through Andrea Nakayama's program. So you're piggybacking two programs there that have a great deal of information. And then when you come into the nursing part of it, you know, you're going to look at this whole scenario, and it's amazing because there is a great deal of overlap, and there are some common denominators. And some of the common denominators are organ breakdown, organ dysfunction, digestive dysfunction, and brain dysfunction because of how we're eating, my 5 W's, how much we're eating, where your food comes from, you know, where is it coming from and what type of soil is it? What's it being sprayed with, all those different factors. And I did post that on my page today. But I want to go over, I just want to read some of this because some people may not understand why we're talking about this. 70% of your immune system is developed inside of your gut in the entire digestive system. And if you're not eating rations throughout the day to support what your body needs to do, it's not going to support your immune system. And then you get sick frequently. Okay, so a lot of the colds and a lot of the viruses that go around, if you're not supporting your immune system through eating and using what are called the PFFCs, then your ability to fight off infection is much greater, or reduced, I'm sorry. You're breaking down the barriers in your body. And for cancer, those T cells are so majorly important for fighting cancer. And if you don't have that support in your body to, you know, fight that cancer, you're going to be in a problem. And then on top of it, the chemo, sometimes it does kill things. Yeah, it kills a lot of things in your body because it's chemicals. And so there are ways to go about this. I'd like to offer support through nutrition guidance because many times people are like out of balance with their activities, the 5 points of awareness and your boundaries with things. And when you become out of balance, your body tells you. Your body tells you you feel out of balance. Maybe you're not absorbing your nutrients. Your brain gets a little bit whacked. And if you let the entire world run you, you will run down and run out. So you want to be fully supported with your nutrition. So real quick, I'm just going to say what the IG immunoglobulins, A, D, E, G, and M, all right? Quantitative immunoglobulins are indicators of immune system function to assist the diagnosis of conditions that result in deficient or excessive production of immunoglobulins. So there's always this balance there, you know. The body is always trying to, okay, we're going to take care of this scenario, and it might be an aggressive attack on something. But if you're not sustained well nutritionally, you will get very sick from that attack. That's why these new viruses cause major issues with some people because they are in a very unstable state of health, especially with their blood glucose. Okay, so we're investigating immune system disorders such as multiple myeloma and to assess IgE levels in order to identify the presence of an allergic or an inflammatory immune response. So some of these immune responses, it's automatically normal for the body to create some inflammation because it's responding, okay? But when, like I said, if you're eating foods that are already causing dysregulation in your system and the pathways are not working easily, there's going to be trouble. And sometimes this is hidden. You are not going to say, sometimes that flag doesn't just show up and say, this is a food, allergy. Sometimes it shows up as a sensitivity. Sometimes you're seeing rashes on your body. You're seeing rashes around your mouth, something on your face. Something's going on internally where there's an inflammatory process or an overproduction of something, or for thyroid, you'll see a swollen thyroid. When things get swollen, sometimes it goes in the opposite direction too. You can get hyper and hypo situations. So the food allergy issue is what I want to focus on, because throughout this, not just the food allergy issue, but also the endocrine issue with insulin response. Okay, so they're telling me in here, IgAs for newborns, and then they give a conventional unit and an SI unit. IgD for newborns and adults, greater than 2 milligrams per deciliter and less than 15 for an adult. And then newborn, so they give you some parameters. IgG for newborn, 650 to, it's got all these different parameters from 1 to 9 months, 10 to 12 months. Okay, so when you're looking at all this and you're looking at these parameters, it might be the IgG, it also has conventional and SI units. It might be that what you're dealing with, because I just listened to a webinar from an osteopath who said that, when you've got that immune burden of an exposure, long-term exposure to mold, and that was my scenario, you are carrying a weight of bricks on your body. Because your body's not only trying to address the normal things that are going on, you've got a mold that is stopping your brain from rebooting at night, from your body rebooting and fighting off these other natural things. Because the antibodies and all these things these are in your body, that's protection. It's designated. These are designated to viruses, to yeast and mold overgrowth, and to parasites and bacteria. So all these things that you're dealing with, the immunoglobulins A, D, E, G, and M are made by plasma. Why do you hear plasmapheresis so much and all these different issues? Those could harm some cells. So really think about this. The most natural form to enhance and support your immune system is by taking care of the environment you're in, and also what you eat and put in your mouth. Okay, so since they are made by plasma cells in response to foreign substances, immunoglobulins neutralize toxic substances, support phagocytosis, and destroy invading microorganisms. They are made up of heavy and light chains. Immunoglobulins produced by the abnormal proliferation of a single plasma cell clone are called monoclonal. Polyclonal increases result when multiple cell lines produce excessive amounts of antibodies. Now, IgA is mainly found in secretions such as the tears, the saliva, and breast milk. That's very important to know. And that's why they always say, it's best to breastfeed your children. It's very difficult to do, okay? Because breastfeeding, it's sensitivity, you've got things going on. And if your body is not healthy and you're trying to nurse your children, you're going to have trouble, because that's what happened to me. but I was able to nurse a little bit. My first one, I was able to nurse for almost 8 months. Then after that, the other ones I had trouble with. So if those are, it is believed to protect mucous membranes from viruses and bacteria. And like I said, those mucous membranes all over the body, you know, the vagina, your mouth, the backside down there, your anus. All those things have a special combination to protect you. And if that is out of balance, that's where things go awry. The function of IgD is not well understood, but I believe we've come to a different place on that. And it is believed to participate in the activation of B lymphocytes. Okay, so we'll find out further down the road when we talk about food allergies, how that might come into play, and how the lymphocytes or the lymphocytes in your white blood count may become hindered from production or reproduction for different purposes. And it could be that your body is dealing with some heavy toxins. IgG is the predominant serum immunoglobulin and is important in long-term defense against disease. It is the only antibody that crosses the placenta. So my IgG was given to my children. So if I had some peanut allergy issues and didn't really know it, but was dealing with it, and because it wasn't until the age of 50 that I really took things under control. If I had peanut allergies or any other nut allergies, or I had, you know, some other problems, the IgG gets passed to your children. It is the only antibody that crosses the placenta. IgM is the largest immunoglobulin and is the first antibody to react to antigenic stimulus. IgM is also forms natural antibodies such as ABO blood group antibodies. The presence of IgM in cord blood is an indication of congenital infection. So here we are, we're thinking about why these things are occurring and what you're exposed to every day. And there's someone that I know that eats a lot of duck eggs and works on a farm. And this person also had a pregnancy, and then they developed some issues with the blood, ABO blood group antibodies. And so then you're wondering, what is going on? Why are these things occurring? And it could be that they have been exposed to something every day that they're handling that could be a problem for the mom and the child. So going back, IgE is an antibody whose primary response is to allergic reactions and parasitic infections. Like I said, if you are malabsorbing or not absorbing your nutrients, you could have a number of things going on. And that is why I strongly suggest that these all be tested. And I know that many physicians may not feel the same, but I think that if we're going to look at a broad spectrum of what is going on with somebody who's got mental health issues and also is having digestive issues that are just going AWOL, and things aren't performing, the toxins aren't being eliminated as they should, they're getting built up, things are building up, and there's a lot of things going on between that soup that's stuck in your small intestine or bacterial overgrowth, things like that. And the yeast can get so out of hand. And a lot of these people smell like yeast. They smell and feel like yeast. And then they try to cover it up with, perfumes and sprays and stuff like that, when actually this stuff is brewing inside of their gut. So we're talking about parasitic infections. Most of the body's IgE is bound to specialized tissue cells. Little is available in the circulating blood. That's why they do some of those tissue analysis to find out if you have any responses. But that doesn't always get to the bottom of things. IgE binds to the membrane of special granulocytes called basophils. And here's where I had a major problem. My basophil count was extremely low, and it just never budged. It fell low, and then it stayed low, and then everything else was affected and stayed in that low status. When I was sick, they could never tell I was sick because my white blood count was at such a minimal status that it couldn't even show the doctors that I was sick, although I was probably septic. My blood pressure was always in the low range, and all these things that are hindering your body from performing, can keep you down, depressed, feeling unwell, constantly just struggling every day. And it's unfortunate that this is happening every single day, and a lot of it is happening to our youth, the young people in our society, the elderly too, but this is happening now earlier and earlier on, and we're seeing mental health challenges and learning disabilities because of it. So most of the body, like I said, in tissue cells, this is available in the little is available in the circulating blood. IgE binds to the membrane of the special granulocytes, like I said, those are the basophils, in the circulating blood, and mast cells in the tissues. And that was another mast cell activation is one of the things that we talked about in just recently at the IMMH conference, which is the Integrative Medicine for Mental Health conference. And, these basophil and mast cell membranes have receptors for IgE. So if those mast cell receptors are being constantly stimulated and there's something going on, there's constant activation, it's going to cause some triggering and anxiety in the body. This is all causing something to go off, and it can affect your brain. And a lot of people after Halloween probably just ate a bunch of candy, or they're going to eat it over the next couple of days, and that's going to depress your body. You'll get hyper and hypo situations throughout the day. It affects your mood. So then that's related to the insulin too. Mast cells are abundant in the skin and the tissues lining the respiratory and alimentary tracts, and that's your digestive system from your mouth all the way down. When IgE antibody becomes cross-linked with antigen allergen, the release of histamine, heparin. Your body produces its own heparin. Did you know that? You have blood thinners. And other chemicals from the granules in the cells is triggered. And some of these can cause, you might see liver dysfunction, and bleeding times are off. Something's going on. You're being triggered. A sequence of events follows activation of IgE that affects smooth muscle contraction. All right. The smooth muscles are having trouble. Oh, here we go. Vascular permeability. So your blood vessels and the permeability of the lining of your blood vessels are affected, and inflammatory reactions. So if you've got all of these things happening so much in your body, and it's trying to regulate and try to figure out how to handle what's going on, because of what you're drinking. Maybe you just drank like a container of chocolate milk or apple cider. You just decided to go wacko with apple cider. Or you just drank a big bottle of kombucha. Or you just had something else. Your body is trying to handle what you're putting in there. And a lot of people are relying on big pizzas. They're relying on their wings that are fried in all these different oils that are causing such major issues. Can't handle it. That's when your body puts up the hand and says, I'm done with you. I am done with you. you are just stressing me out. And then it just wants to drop, That's what happened to me several times. I just passed out. That was it. So the inflammatory response allows proteins from the bloodstream to enter the tissues. Now, this one sounds terrible, but guess what? It's real. Helminths. Oh my God, this reminds me of like The Mummy, the movie The Mummy, or worm parasites are especially susceptible to immunoglobulin-mediated cytotoxic chemicals. The inflammatory reaction proteins attract macrophages from the circulatory system and the granulocytes, such as eosinophils, from circulation and bone marrow. This is all connected. The white blood count, the red blood count. Where's it coming from? Where is it produced? And when people have bone pain and their bones ache and their bones are breaking, we are torturing ourselves with our food and our environment. And it can cause some really horrendous outcomes. Eosinophils also contain enzymes effective against the parasitic invaders. A nasal smear can be examined for the presence of eosinophils to screen for allergic conditions. Very interesting. Either a single smear or smears of nasal secretions from each side of the nose should be submitted at room temperature. So what are we doing right now with COVID? Exactly that, right? We're doing it for COVID, eosinophils. Okay, so we're looking for COVID, but can we determine something else is coming up with COVID? What else are we looking for? Either a single smear or smears, I told you that, at room temperature. For Hansel staining and evaluation, that's what it's called. Normal findings vary by laboratory, but generally greater than 10 to 15% is considered eosinophilia or increased presence of eosinophils. Results may be invalid for patients already taking local or systemic corticosteroids. They are placing so many people on steroids for these inflammatory responses. And I can tell you, it drives your body crazy, increases your metabolic rate, and makes you hungry. All right? It increases. I know that my brother was on a lot of steroids for sarcoidosis. I actually was on some steroids for all these different skin conditions that were popping up at different random times. I looked like I had malaria. I don't know what I was dealing with, but it looked like it. I was exposed to TB. I was put on TB medicine, medicine for TB. And there were other things that, we try to go towards, but there's also just back it up. Back it up. Let's not throw things at that immune system and block it and damage it. Let's try to support it. Let's try to support the entire pathway in our gut lining wall so that it performs and that the barriers that need to be there are there. So things aren't leaking into your bloodstream that shouldn't be there. We got to look at why are these barriers breaking down? Why are ulcers occurring? Ulcerative colitis, different types of, areas of polyps are developing in all these different areas. And what's going on? Why is the whole digestive system slowing down with hypothyroidism? Because you're wearing it down. You're wearing your body and all of the organs down with what your, eating and drinking habits are. That's part of it. Okay, so we're going to stop there for now because the next video is going to be specific indications to understand, why multiple myeloma or myeloma is occurring and some of these polyclonal issues and what other factors are involved in a depleted immune system and malabsorption. Diane Greco-Allen, food relationship coach, functional medicine certified nutrition counselor, wishing you a beautiful day. And just remember that what you nourish your mind and body with is the reflection of what you're going to live your life like. So, peace to you today. Have a wonderful day, and hopefully we'll catch up soon. Thanks.